Hello, ladies and gentlemen. Welcome to my channel. This is Dr. Emmanuel. And as you can see from this screen, we'll be talking about the blood supply of the human brain. In other words, we'll be looking at the Circle of Willis or Circulus arteriosus, okay, which is a circular architectural orientation of blood vessels that supply blood to the human brain. And this is actually a picture of a real human brain. I extracted this image from the internet, from Google. And as we can see, we have a near circular orientation of blood vessels that form that Circle of Willis. And here we can see the basilar artery lying, in the midline of the pons, in front of the pons, anterior pontine sulcus, and you can see this basilar artery being formed by the right and left vertebral arteries. And then we can see the basilar artery, giving out these terminal branches, the posterior cerebral arteries, right and left posterior cerebral arteries. Okay, and there we will also see the superior cerebellar, okay, the superior cerebellar arteries, emerging from the basilar artery. Right there we can see the internal carotid. The internal carotid emerges from the from the carotid sinus, from the cavernous sinus, I meant to say, has the intracavernosal course, and then eventually emerges to join these Circle of Willis. So that's our internal carotid artery, okay, right and left. And we can see the anterior cerebral arteries, and then middle cerebral artery. Okay, that's the middle cerebral artery. We've got the anterior, and joining the anterior cerebral arteries there will be the anterior communicating, and we've got the posterior communicating there. That's the PCA, posterior communicating. Yeah, that's the one. So let's this image is extracted from the Atlas of Human Anatomy by Frank Nettas, and on this picture we can see our basilar artery there. Okay, so the pons will also be somewhere there. Sorry, I think I got a flu from work. Attended to a patient who was coughing, and I probably have picked up a flu. So that's our basilar artery. We can see our right and left vertebral arteries. So we can see that the vertebral artery actually comes from the subclavian artery. So we've got our right vertebral artery, which will run through the transverse processes of the vertebral bones, of the cervical vertebral bones, and eventually emerge into the intracranial cavity. Okay. And then the right and left vertebral arteries would join terminally to form this basilar artery, as we can see. Okay, and there we can see our posterior cerebral arteries. So the posterior cerebral arteries are terminal branches of the basilar artery. Okay, and close to the termination of the basilar artery, we can also see the superior cerebellar arteries. Okay, right and left. And there we can see our anterior inferior cerebellar arteries, right and left, and we can see the posterior inferior cerebellar arteries also on both sides, right and left. And then this is the common carotid artery. Okay, the common carotid artery, which is a branch of this brachiocephalic trunk on the right side, and the left common carotid is a direct branch of the arch of the aorta. So these common carotid arteries, excuse me, divide into the external carotid and the internal carotid, and the internal carotid eventually has an intracranial course. Okay, and there the internal carotid The internal carotid actually has two terminal branches, which are the larger middle cerebral, and usually the smaller anterior cerebral artery. Okay, and there is the anterior communicating artery that ensures that blood, can actually communicate between the two cerebral hemispheres. So you have areas of anastomosis, but usually these areas of anastomosis are not perfect anastomosis. And that's why when someone has an occlusion of a blood vessel on one side of the brain, they usually have a stroke. If there was a perfect anastomosis or communication, if one part of the brain is occluded, and blood supply from the other side should be able to fully compensate, but that doesn't happen in most cases, unfortunately. The sagittal view, through the head and neck of a human being. This is also from Frank Netter's atlas. Just as we've seen the previous image, our common carotid artery, dividing, terminally into our internal and external carotid. And we can see the internal carotid, running through the cavernous sinus. So that's the intracavernous course, of our of the internal carotid, and then it emerges, from the cavernous sinus, okay, into the intracranial cavity, where it then contributes to supplying the brain. And they're running through the transverse processes, okay, of the cervical vertebral bones is the vertebral artery, okay? And then you can see the vertebral artery entering the intracranial cavity, the cranium. And then you can see, if you look there, you can see the right and left vertebral arteries actually, uniting to form that basilar artery. Okay, so you can see our basilar artery there. And this gives us a closer view. So we are coning in now on this Circle of Willis. It looks circular or pentagonal. Okay, I think I saw somewhere many years ago as a medical student. I thought in one of the textbooks, they also called it the Pentagon of Willis, or Circle of Willis. So vertebral arteries uniting to form the basilar artery. So we'll keep repeating it because repetition helps things sink and makes it, become less cumbersome mentally. So that's the basilar artery, and we can see basilar artery terminates, by branching off, into the right and left posterior cerebral arteries. Okay. And before that, we can see the superior cerebellar arteries offsetting. We can see the pontine arteries that supply the pons veroli. That's the anterior inferior cerebellar artery, ICA. And before there, somewhere there, we have our pica, the posterior inferior cerebellar arteries. So we've got the internal carotid, we've got the middle cerebral artery, which is a terminal branch of the internal carotid, and we've got our anterior cerebral artery. So this middle cerebral, so if you look at this circle, if you trace this circle or pentagon, you realize that this middle cerebral artery is actually not part of this pentagon or circle. So usually it's said that the middle cerebral artery actually is not part of the Circle of Willis. So the components of the Circle of Willis are obviously the basilar artery, both right and left posterior cerebral, both right and left posterior communicating, the internal carotid arteries right and left, the anterior cerebral arteries right and left, and the anterior communicating artery. When you draw it all together, so the middle cerebral is not really part of that circle, but it's obviously something very important because it's a terminal branch of this internal carotid artery and a major blood supply to the cerebral hemispheres. There we can see our cavernous sinuses right and left, and you can see the internal carotid artery coursing through these cavernous sinus, and that's why if someone has a cavernous sinus thrombosis, they could actually have a compromised internal carotid. The only reason is that the internal carotid is an artery, it has a high, it's got it's got a high pressure, blood pressure within it. It's got thicker walls than veins, so That's going to be like the saving grace for a patient with cavernous sinus thrombosis, that your carotid arteries may not may not be compressed, even if you've got that cavernous sinus thrombosis. But it's important to know that there's a possibility of compression, or compromise of this internal carotid, okay, causing maybe a cerebral steal, reduced perfusion of the brain. That's our pituitary gland. That's our optic chiasma. Okay, you can see. So this is the hypophyseal area, really. There are some variations, which I found on this Circle of Willis, which I think is important to mention. So there's something called the azygous anterior cerebral artery. And this happens when you have a large anterior communicating artery. And then you have, so one internal carotid artery can supply both anterior communicating arteries. So if we go back, this is our anterior communicating, okay? So what it means is that if you have a large anterior communicating artery, and you have, so blood supply from one side of the brain can flow through this anterior communicating, flow through that large, through the anterior cerebral, flow through that large anterior communicating to perfuse the other side of the brain. Let's assume there's a blood clot blocking this anterior cerebral on this side, on this left side, and you have a large anterior communicating here. Blood can sufficiently flow to perfuse the compromised part of the brain, and that's called the azygous anterior cerebral artery. Okay. So even though it's called the azygous anterior cerebral, not anterior communicating, which I felt it should have been called azygous anterior communicating to avoid confusion, it's actually a large anterior communicating artery, which then means that one anterior cerebral artery may be sufficient to perfuse both the ipsilateral and the contralateral cerebral hemisphere. Okay. And then I also saw what is called the fetal posterior communicating cerebral artery. And that happens when you have a large posterior communicating artery, such that one internal carotid can supply both posterior cerebral arteries. So these are the posterior cerebral arteries here. And imagine if you have these posterior communicating being large, then blood flow from these internal carotid, can sufficiently go through that large posterior communicating, to perfuse both these ipsilateral means on the same side. So this ipsilateral posterior cerebral, and also flow to perfuse, the contralateral posterior cerebral artery. Okay. So if you have a large, sufficiently large or larger posterior communicating, that's called the fetal posterior communicating cerebral artery. So this one, in nomenclature, you have both communicating and cerebral, and here you have just cerebral without communicating. So I personally think the nomenclature is not descriptive enough, but you just have to know that these variations do occur. To be honest, there are variations in the size or calibers of these blood vessels, and that's why people have different propensities to developing ischemic strokes. This is a topographic orientation of how these blood vessels sit on the brain. So exactly as we saw previously, okay, basilar artery just sits there in the median pontine sulcus, okay. You can see the vertebral arteries. You can see our anterior spinal artery arising from both vertebral arteries. Okay, still to recap, there's no harm in repetition. And superior cerebellar arteries, our right and left posterior cerebral arteries. We've got the posterior communicating. Posterior communicating communicates between the internal carotid and the posterior cerebral artery. Okay, and that's our internal carotid after emerging from the cavernous sinus. Okay, we've got our middle cerebral. Okay, that's the middle cerebral, which we said is not actually part of the pentagon or Circle of Willis. And this Circle of Willis is also called Circulus arteriosus. I think that is Latin. So we've got the anterior cerebral artery there. We've got the anterior communicating. Okay, got the anterior communicating. right? And you can see how these blood vessels all come together to supply the cerebral hemispheres, okay? And even the cerebellar hemispheres, the superior, anterior, inferior cerebellar, posterior, inferior cerebellar arteries, they all supply the cerebellar hemispheres, okay? And you can see those. So if you look at the way this supply happens, it can give you a clue as to parts of the brain that could be affected when there is a stroke. Okay, if you understand that. So if we can see here, we can see the anterior cerebral artery supplying most of the medial surface of the cerebral hemisphere. So what it tells you is that if you have occlusion, an occlusion of the anterior cerebral artery, you're likely to have deficits of those functions, sensory and motor functions that are subserved by this medial surface of the brain. Of course, like vision, you can see the calcarine is well, this is actually posterior, but I'm talking about the medial surface. You can see things like, when we look at the human homunculus, I'm not sure if I have the homunculus on this. I haven't got the homunculus on this. I think we have the homunculus on the video where we looked at the motor and sensory areas of the cerebral hemisphere. So when you look at the homunculus, it can give you an appreciation as to what functions can be affected when the middle cerebral arteries is occluded, when the anterior cerebral artery is occluded, or when the posterior cerebral artery is occluded. Okay, so the posterior cerebral artery usually supplies the occipital, most of the occipital lobe, as we can see. That's the posterior cerebral there. And you can see it's actually giving blood supply, to most of the occipital lobe and even the inferior part of the temporal lobe. The middle cerebral artery is there. Okay, and we can see the middle cerebral artery supplies most of the outer outer convecture, the lateral surface of these frontal parietal lobes. Both the frontal lobe and the parietal lobe, the lateral surfaces are largely supplied by the middle cerebral artery. Okay, yeah. And also part of the temporal lobe also is supplied by this middle cerebral artery. These are the cerebellar arteries, arising from the basilar artery, which we can see the superior cerebellar, we can see the anterior inferior cerebellar, and then we can see the posterior inferior cerebellar arteries. I can see that they supply, both, the right and left cerebellar hemispheres. Okay, so this brings us really to the end of revising the blood supply of the brain, the arterial supply of the brain. Feel free to watch this video over and over, review your atlas, answer some multiple choice questions, just so that things, become much clearer. So if you think this video has been helpful, kindly smash the like button, subscribe to my channel, share with your friends, and hit the notification bell so you'll be notified when I produce, more videos, more anatomical or medically related videos. Thanks for your attention and all the best.